Hey there, it's Fox. Again, since so many months, I decided not to go to university today, but to shoot so many videos. I really want to tell you so many things. But I really have to say, I'm sorry that it took me so long to shoot another video. I think I just can say life got in the way somehow. And I was very ill for a lot of months. And I just watched the last video I made, and I have to say I feel so much better now. I feel so much healthier, and I came out to a lot of people who really reacted great. I found so many people who are going through the same stuff that I am, even in Germany. And yeah, I decided to divide the videos for different themes, and this one shall be about therapy. So I went to my psychiatrist. I talked about last time. He is a specialist for sexual medicine and sexual therapy. And the first time I was there, I wasn't really sure if I liked him because I have experienced sexual violence in my childhood, and he said this will be a thing we have to talk about, and we have to make sure that that's not the reason why I don't want to have breasts. So that was something I expected, but he said he has to ask sometimes provocative questions, and I wasn't really sure if I liked that, but I have to say our relationship really changed throughout the month, and yeah, I want to tell you about him. So he said I'm the first genderqueer person he works with, and he knew that someone in Hamburg, another specialist, has worked with genderqueer, non-binary people before. So he called him after our meeting, and I think that was really great that he wanted to connect with someone who has been there and that he wanted to get their point of view. So when we met for the second time, he could tell me a lot about what they think would be the best way to go for me, and that will be having therapy for at least 1 year, and just finding out that it's really a gender identity crisis, like it's called in Germany. So that I'm really trans, but not trans in the way as I want to become a trans man or be a trans man. So he said it will be really hard and it will be difficult and we may not succeed, but he will be there for me, and he wants to be there on the way with me and help me, but he really wants to be sure that I know what I'm doing and I know how hard it will be, and that he wants to know that I'm sure that not having breasts is the way I want to go. So since then, so much has changed, and I really found out that therapy is between the sessions. You just talk about what has happened between the sessions a lot, and we worked with images from my childhood. I brought him so many images of photos my family took, and it was so strange to see because I never realized it until now that my parents let me be who I am for most of the time, especially when it comes to clothes. So I could wear whatever I wanted. My parents would never say that looks crazy or something. And my grandma was really the other way around. She always dressed me up in dresses and skirts and so girly like. And when I had these pictures, I really saw, I didn't have to know, you just saw from the picture which person I was with this day and which person may have influenced my dressing. And yeah, when I dressed as I wanted, I always dressed gender neutral. I never realized it, but as a child, you really couldn't tell. Just maybe from my extremely long brown hair that I was a girl. But not from my clothes. So I loved all beige and nude colors and just no blue, maybe gray, or red, something like this, but or green. I love green. I still love green. Yeah, so really gender neutral, and I think that was something my therapist never saw this way. So it was kind of new to him. And yeah, we talked a lot about my family and how I grew up and which image of being a woman and femininity I grew up with, and how that felt for me, and if I felt pressure to be a woman, and if that may be the reason now I don't want to be. But yeah, I found out that I couldn't tell what is feminine to me, because I think the whole concept of being a woman or being a man is just human made and a concept, and nothing really I could support with my heart or even politically. So we asked the question, what is gender for me? And that was really hard to explain, because in German gender and sex is the same word, and I tried to explain that these two that this one word in German has for me two different meanings, and that there are there could be as many genders as we have people in the world, if everyone would at some point in their life think about which gender he, she, they have. And yeah, then my therapist asked me what would change if I would live in a world where gender and sex doesn't exist, where just nobody talks about it or categorizes people in this way. And then I said that I would feel a lot better, because I wouldn't be pressured into role models or roles I didn't want to be in, but that there will still be one thing wrong with me, or I wouldn't be happy about, and that would be my breasts. And we found out that if I would live in a world without gender, having a mastectomy would kind of be like plastic surgery just for beauty reasons. Because I know that my breasts don't define my gender and they don't make me a woman. But I know that people for people having breasts is one reason to say this person is a woman, because most people don't know about different gender identities and genders at all. Most people think there are only two genders, and even though we have a lot of publicity about trans people in Germany, it's always about transitioning from one gender to the other. So this binarity is still something everyone talks about, and telling people I'm neither one nor the other is for most people something they can logically understand, but they have no idea how that feels. Yeah, so for me it was really great to see that my breasts don't define me as gender-wise. So that was a point where I really felt better, but still I have body dysphoria and I don't like my breasts, and I hate for people to know how much I really have in front of me. Sorry for these strange words. So therapy is great. I really enjoy it, and when we talked about the world without gender, my therapist said he wouldn't say that he's a man if he would live in a world without gender. Well, that's clear because there wouldn't be words for this, but I think it's really great to know that he has thought about his gender and he isn't conform with everything a man should be, or how the community and people in general define being a man. So I like it, and I have an appointment this Friday, and I am really looking forward to this one because so many things have changed, and I have found out so many things I want to tell him, like that I found out that one genderqueer person in Germany got their health insurance to pay. I'm sorry, my dogs are making some noise. I hope you still understand me. That genderqueer person got their health insurance to pay the mastectomy, but that was after they had gone through it as paying themselves. So the person tried to get the health insurance to pay for the mastectomy, but they didn't do it, and then the person did it and paid for the operation, the surgery themselves, and afterwards they went to court with the health insurance, and they found an agreement of court. I don't really know the words in English, I'm sorry. Just the court didn't tell the health insurance to pay. They just did, and then the whole case fell apart because there was no case anymore, because then they decided to pay, and they did this so that there wouldn't be a lot of publicity and that other genderqueer people wouldn't find out about it. And I did, and I'm really happy. And I think that says that if you are persistent and you fight for your rights, often you will get lucky and people will understand that it is your right, and having a non-binary gender identity is something nobody could say something against anymore, I guess. Yeah, I'm sorry, my dog wants to bark. Just one moment. Ah, okay, he decided to stop himself. Okay, yeah, that actually I didn't really want to talk about this in this video, but yeah, that's something I will tell my therapist, and I'm really happy about it. And I have made it through the first half year, so until October it's not that much time anymore, and in October I guess I will have a diagnosis, and then I will ask the health insurance for the money for the operation, the surgery. I'm sorry, in German you say operation, and I know in English it's surgery. Sorry. Okay, I guess that's all about therapy at the moment. No, I want to talk about something else concerning therapy I found out that is really kind of interesting to me. I found, being trans, in one way or the other, being trans has a lot to do with waiting. You wait for time to pass a lot of times. You really, especially in Germany, where you have to have 18 months of therapy before you can get mastectomy or change your name and stuff. It's really almost all the time about waiting for the time to pass. And I found out that when I'm about to have a therapy session, I'm really happy and I am excited and looking forward to taking the next step, and yeah, bringing another step behind me. I don't know if you say it in English, it's the German expression, but I hope you understand me. I'm sorry. Well, just so I'm really happy when I'm going to have a session, but when the session is over, the first 2 or 3 days I'm feeling so unlucky and so disappointed because I have yet to wait another month before I can say the next step is made, the next step is gone. And I found out that I am really in a cycle, and from one session to the other, at first I feel so unhappy the first days, and when the days pass and time passes, the more time passes, the more I feel happy again and thinking, yeah, I'm excited, the next step will come, and when the next session is there, I'm feeling unlucky again. So that's something I found out for me, and I want to talk about with my therapist, because I think it's strange. Maybe not, maybe it is. I have asked other people if they feel the same, but nobody really understood what I'm going through. They all thought it is a big deal for me, but it really isn't. It's okay to feel unlucky sometime and to be sad or disappointed or angry with the system. That's really okay. And it's also good to know for me that I always come out of a low, and there always will be another high. And yeah, I just wanted to tell you this because maybe someone else is going through the same and sees this video and can tell me something about this, or how they yeah, work with these feelings, how they get along with it. Then please leave a comment. And always, guys, always, please leave a comment. I love to talk to you. I would love to write emails with you. I don't have Skype or something like this. I'm not really a person for much internet stuff, Facebook and so, but I love emailing, so if you want to talk to me, just write me a mail. Ask for it. I will tell you the address, and yeah. I hope you enjoyed this video. It's crazy long. I didn't think it would take me such a long time to talk about therapy, but I hope I didn't ramble too much. I hope you understood my English. I know I really have to work on it. I'm sorry about the dogs, but here is the best light, and I hope you can see my face. Okay, have a nice day. Till the next video, and I'm so happy that you watched this. Goodbye.